over the course of those 15 or 17, 18 years, have there been any big highlights or amazing studies that you just look back and go, wow, look at what has happened since that phase 1 study that we were involved in, where that drug's gone?
There's one, Charles, that if I'm granted 10 minutes on my deathbed to look back at, I'll say I was immensely proud of being a very tiny cog in the big wheels of development of that cure for hepatitis C. So I hung on to the coattails of Professor Ed Gain, who's a hepatologist in Auckland, a global reputation, and Ed deep understanding of hepatitis C and deep connections with pharma and biotech companies as these molecules were being developed. And the first time, so hepatitis C is a viral disease that's the most common cause for liver transplant in New Zealand. And it's now cured with 1 tablet a day for 8 weeks. And there are countries around the world like Egypt where there are millions of people who have hepatitis C. It's an enormous drain on their economy and a terrible burden for someone who has hepatitis C on a personal and family basis. And they're curing millions of people. They have a national program to eliminate hepatitis C. Wow. And the first time the drug sofosbuvir was ever given to a human was in Christchurch, New Zealand.
Fantastic.
It's a wonderful
amazing
story.
So it's a small molecule drug, is it?
Yeah.
And man, that's fantastic. Because at the end of the day, I mean, it's very easy to talk about like the scientific interest and like the financial benefit for a company or a sponsor or just the people working in a high value industry. But at the end of the day, it is about the patients. It is about the end user. It might take 40, it might take 50 years, it might take 20 years or whatever, but that's the end user at the very end of the storied series of events that happen. That is what it's all about, right? I mean,
absolutely, absolutely, and we get lots of feedback, particularly from these hepatitis C patients. A decade after their cure, we still have a guy bringing us a bunch of flowers out of his garden every year. So it's such a lovely story.
So I don't know too much about hepatitis C. So obviously it's a viral disease, embeds itself within the liver. The liver over time loses function. How does that?
Develops fibrosis, cirrhosis, loses function,
and then you either need a transplant or it's good night nurse, essentially. Yeah. And sorry, what's the drug's name? Sofosbuvir. So that eradicates the viral DNA.
It's now in combination with a couple of others, but it does, and it's just it's a wonderful miracle-like story. There won't be another one in my career,
right?
Like that.
Yeah. It's almost like science fiction. When we hear of like, oh, you're cured of this disease or whatever, it doesn't happen that commonly. I mean, a lot of the treatments that we have available for a lot of things these days are more to manage the symptoms or to manage the progression or to just manage the disease in general. But it's very difficult to be curative. And this is a fantastic story of a proper functional cure forever from 8 weeks of daily treatment.
Tablet a day.
Fantastic. And isn't New Zealand Clinical Research doing some work in CRISPR as well with some biotechs?
Yeah. So we have multiple studies across a wide range of therapeutic indications, ranging from brain cancer to fungal toenail infections. And when I tell that story, people laugh at toenail infections, and yet in some countries around the world, maybe a quarter of the population have a fungal toenail infection. No treatment, really sore feet. They're not particularly mobile in terms of vehicular transport. They have to walk everywhere. So it is a problem.
Yeah.
And so we're working with a company looking at a potent antifungal that'll make a difference there.
Yeah.
So big molecules like antibodies, small molecules like aspirin or paracetamol, mRNA drugs, and then the class that may make more of a difference in the long term, but is very experimental and extremely tightly controlled at the moment, is gene modification.
Yeah. Yeah. I mean, that's proper science fiction, that stuff, isn't it?
Some of it's a fact now. That's right. Commercially available, treating diseases where there's a point mutation in a gene, fix that up, and they're normal for the rest of their life.
Yeah.
That's just wonderful, wonderful stuff.
We've kind of graduated from small molecule interventions into the kind of gene editing, RNA. You know, the further we get, the closer we get to the genome where there is like an actual genetic mutation and we can intervene, the more effective. But and talking and speaking with some people that work in these fields, you know, like antisense oligonucleotides and that kind of thing, RNA interference, you know, they're a little bit, although they're closer to the genome, although they're further upstream of where the problem really is, they're actually faster to develop than some of the small molecules because they're more targeted. I mean, like I had Dr. Sarah Diermeyer, who is the founder of Amarok Therapeutics, and they're developing antisense oligonucleotides for link RNA, long non-coding RNA. You know, so DNA dark matter, amazing stuff. But they can be in the clinic from benchtop science to being in the clinic, so clinical research phase 1 trial, within like 5 years or something. You know, as opposed to the 2030, you know, a lot of the fundamental science that needs to happen for these small molecule drugs. Yeah, it's incredible. So maybe over time the development will just be accelerating because we have greater understanding of both the human body, the mechanisms of action, genetics, and these really fancy tools.
That's true, but it may not be the whole answer. We have to ensure that the regulatory controls keep up with that. And you know that regulators are part of bureaucracies that tend to move more slowly. And so the scientists, the university professors have brilliant ideas, develop it in the lab, go, a lot of energy. But regulators have a responsibility to say, what are the consequences of this? How safe is this? Because their fundamental aim is to protect the population.